All right, welcome back. We now want to take you to the NHIF offices where the private hospital heads are meeting over the NHIF standoff. We'll get to listen in and we'll give you a report afterwards.
Moves us from, removes the inefficiencies that we have and moves us towards making that we have a lean, mean service delivery organization. The third one is IT transformation, and that was very key in the Act, where now we'll have a centralized health management information system connected to all our service providers. And fourth is the benefits package that we have been discussing with our service providers over here. And those benefits packages are the ones that sparked a need for us to really engage and re-engage. As directed, we now have expanded the space for sufficient consultation so that we can be able to allow our service providers to go and consult with their suppliers, with the other people in their fraternity. We understand that in both cases there has to be a give and take, adjustments have to be done. And the real mission and vision is to reduce the healthcare costs. As such, it was proposed, and we have agreed with the CS that we extend this consultation from the deadline of today, and we are pushing it up to the end of March. We have created work teams that will engage with each other so that we can come to a good agreement and understanding. And as such, the contracts between NHIF and all service providers will be signed after the 30th of March or 31st of March, because the 31st March has 31 days. And for implementation, we will start the new contracts with the new benefits on the 1st of July, which is in line with the calendar year for the government. So as such, we can say that we are going on with the old contract for the next 5 months, February to end of June. But as far as making sure that we are all in tandem and in line, we are going to make sure we do that by the 31st of March. We have had very fruitful discussions, and you will hear from the chairman of the Kenya Association of Private Hospitals, who will give a small statement on the engagement. We also have Kenya Faith-Based Association, who will also make a comment. But we also have consumers. We have somebody who consumes, it says it's the only person with 3 kidneys over here, who is a beneficiary of the renal department. And we also have a representative of people who live with AIDS, and then I think we can move on to questions. So, Chairman Kaf.
Thank you.
Business more.
All right, live pictures there of the private hospital leaders meeting at the NHIF. And of course, that's a story we are going to follow up and keep you updated on the latest.